Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
What is botulinum toxin injections for movement disorders?
Botulinum toxin injections are used for specific movement disorders, and the goal of the botulinum toxin is to alter the nerve signal to weaken muscle, as usually in movement disorders the muscles are overactive, and so by weakening the muscle it treats the movement disorder.
Why would a patient need this procedure?
Botulinum toxin can be used for movement disorders. Movement disorders include, for botulinum toxin injections, include cervical dystonia, which is overactivity of a muscle in the neck, blepharospasm, which is involuntary blinking, hemifacial spasm, which are twitching or spasming of muscles on one side of the face, are common movement disorders that we use botulinum for.
Would a patient go to their primary care physician first?
A patient might go to their primary care physician, but if their primary care physician is unclear of the diagnosis, they would usually refer to a neurologist. Regardless, a neurologist should evaluate the patient to confirm the diagnosis.
How necessary is a referral by a neurologist?
It is necessary because the neurologist, one, has to confirm the diagnosis, and two, they have to provide the necessary information for insurance companies to approve the botulinum injections for the said diagnosis.
How long does this treatment last?
The treatment lasts for, on average, 12 weeks, and then they usually need repeated injections every 12 weeks to continue the effectiveness of the medication.
How do the toxins work in treating movement disorders?
The toxin works by altering nerve signals, so it actually blocks signal to the muscle and therefore weakens muscle. In most of these movement disorders, there's increased activation of the muscle, so by weakening the muscle, it actually helps the disorder by calming down the muscle activity.
Are there any side effects of this treatment?
There are side effects to the treatment, but it depends on where you are injecting it, whether it's the face or the neck. And so the side effects is something to discuss with your physician.
Is this referred to as Botox injections?
Botulinum toxin injections are referred to as Botox. However, there are also other brands of botulinum toxin, such as Xeomin and Myblock. Botulinum toxin is used for both cosmetic procedures and for movement disorders. As neurologists, we actually use it for movement disorders and specifically to weaken the muscle from that perspective to treat the movement disorder.